when the Trump administration announced massive cuts to federal health agencies. Health and Human Services Secretary Robert F. Kennedy Jr. said he was getting rid of excess administrators contributing to bureaucratic bloat. NewsPulse found the administration cut deeper than acknowledged, losing thousands of scientists and the support staff they rely on. Despite claims of adding scientists, these reductions, aimed at government efficiency, have stretched departments thin in performing basic functions according to interviews with former and current employees. Over 20,500 workers, or about 18% of the Department of Health and Human Services workforce, have left or been pushed out. This includes more than 3,000 scientists and public health specialists and over 1,000 regulators and safety inspectors. The analysis is likely an undercount as it doesn't include workers on administrative leave. No health agency was spared. CDC lost 15% of staff, NIH 16%, and FDA 21%. Thousands were laid off, had contracts cut, took buyouts, or retired early. The cuts create a brain drain, including senior leaders critical to initiatives like the COVID-19 vaccine rollout. Inspectors now buy their own supplies for pathogen testing. Some labs lack sterile eggs for virus replication or mice for vaccine testing. Infectious disease scientists struggle to afford basic supplies despite a recent deadly pandemic. Cuts contradict stated priorities. While Kennedy questioned vaccine safety, scores of vaccine regulators were pushed out. The CDC lost over 1,050 scientists, physicians, and public health specialists alone. Critical work like maternal health tracking, injury surveillance, and lead poisoning monitoring lost key personnel. The Chronic Disease Center at CDC saw 20% staff cuts, with nearly half being scientists, undermining Kennedy's declared war on chronic disease. The Office on Smoking and Health was gutted, endangering tobacco tracking and prevention programs at NIH. More than 1,450 research grants were terminated and over $750 million withheld. Staff handling grant funding were fired, delaying payouts and forcing universities to pause research, fire staff, and reduce admissions. The National Institute of Allergy and Infectious Diseases lost 17% of its workforce, including many senior officials potentially due to political retribution, hindering infectious disease research. HHS did not dispute NewsPulse's findings nor explain why it withheld workforce data. A spokesperson defended cutting bloated bureaucracies to redirect resources to impactful science and rebuild public trust. Former Health Secretary Xavier Becerra called the cuts reckless, warning they dangerously hollow out expertise and public health protection.